And good afternoon, everybody, and welcome to Partnership Lessons from COVID-19. This is part of this year's Famau Affrica Summit, Global Undod 2021. I am Beth Kidd, I'm one of the Development Support Managers at Famau Affrica, and I'm hosting this session along with my colleague Emma. This is a webinar format, so you will only be able to see the presenters at the moment. Not the other people in the session, and only the panelists can share their microphone and video. To contribute to the discussion or make a comment, please use the chat box function at the bottom by clicking chat in the Zoom toolbar at the bottom of your screen. And to send questions, you can click the Q&A button in the Zoom toolbar, and the host will allow time to address the questions once they've been submitted. We've got a little bit of housekeeping. Oh, it says the wrong thing. It's not a Zoom meeting format, it's a Zoom webinar format. So please ensure your name and organisation are showing if you can. And we've got a couple of polls that we're going to launch, one at the beginning and one at the end, which helps us guide the work that we do. Just to say, this is a safe space for minoritised people and all forms of abuse will not be tolerated. We encourage challenging and constructive conversation, but people's lived experiences are not up for debate. If you have any serious concerns after this session, then go to www.wcia.org.uk and search for their whistleblowing policy, and that will tell you how to make a safeguarding complaint. This is the agenda for today's session. I'm shortly going to hand over to our chair, Makhele. He's going to welcome everybody and do a quick situation update on the COVID-19 pandemic in Africa. We're then going to move on to hear about some lessons learned from the COVID-19 project in Zambia with Mothers of Africa and Dr. Judith, and then lessons from Lesotho and Dolen Cymru with Dr. Kate Shakespeare and Dr. Mosa. We'll then have a quick Q&A session at the end before we do the final poll and close. So I will stop sharing this screen and put up the second presentation. Are we going to do the poll? Oh yes, good point. Yeah. Let's do the poll. Okay, I should, hopefully you can see that. So this is the first poll, which just is asking you what sort of information and topics you're interested in for our future work. I'll give you a couple of minutes to complete that, if that's okay. Brilliant. As you can see, a couple of people have submitted their responses. This is a standard poll that we've done across all our sessions. So if you've already filled it in another summit session this week, you don't need to fill it in again. Thank you for your participation. Okay, I'll give it 20 more seconds. Okay, don't worry if you haven't had a chance to fill that in. Like I say, it will be available in the other two sessions that we've got. Two sessions? One session that we've got going on today. Okay, lovely. Let me share the screen and hand over to Makhele to give us an update on the COVID-19 situation in Africa. Mac. Well, Mac, we can't hear you. I don't know if you're on mute.
Sorry about that. Yeah, I was just introducing myself. My name is Makhele. I'm a retired consultant in public health medicine, used to work for Public Health Wales, and one of the trustees of Wales and Africa Health Links Network. Right. I'm going to give a quick update of the COVID-19 situation in Africa, particularly, and colleagues from Zambia and Lesotho will update us on situation out there in the field. Can I have next slide, please? Okay, so this graph shows us the evolution of the pandemic since the beginning last year. And you will see that the UK had, well, the worst in terms of cases per head of population. That's the red line there, worldwide, followed by the USA. And you notice that the African countries at the bottom there, in fact, the numbers are so small that you can hardly see the graph very well because of the large numbers from the Western world. So Zambia, Egypt, Malawi, Nigeria, etc. are at the bottom. Okay, next slide, please. And in terms of the numbers, to date, we've had about 120 million cases worldwide and 4 million in Africa. And the cases in Africa, 3% of the world cases, whereas Africa, 17% of the population worldwide. And the deaths, we've had 2.6 million deaths worldwide and 108,000 deaths in Africa. In terms of the fatality worldwide, the case fatality rate worldwide has been 2.2%, and in Africa has been slightly higher. And that's not surprising given the limited healthcare facilities in most of Africa. Okay, next slide, please. So that's the pandemic in Africa. The shape is similar to the pandemic anywhere else in the world. Next slide, please. Right, and within Africa, there is a very interesting gradient in the numbers, in incidents of the pandemic. There's a gradient that goes from the equator going south or north. So you see that the central area has had fewer cases compared to the rest of Africa, followed by the western region and eastern region. And then as you move further away from the equator, you get more cases. So the northern region has had 1.2 million cases, and the southern region has had the heaviest toll, as it were, in Africa, 1.8 million cases. Next slide, please. Okay, so this shows you the numbers in each country. I've actually removed the numbers for South Africa because if you include that, it crashes the graph, and the rest of you can't see the numbers for the rest of the other countries so well. But the next slide will give the incidence by per head of population, and that includes South Africa. So you see that the highest incidence has been in South Africa, followed by Eswatini. I haven't actually included the rest of the regions because the southern region has had the highest toll, as it were. So I've tended to focus on the southern region. Eswatini is interesting because it's quite a small country, but incidence has been very high. When we first looked at the situation last year, Eswatini didn't figure very highly at all in the numbers, but it has moved on from being barely noticeable last year to having the second highest incidence next to South Africa. Okay, next slide. So those are the numbers, the absolute numbers in Southern Africa. I've included Uganda, which actually is in the central region at the top for comparison purposes. So you say that Uganda has only had 887, cumulatively, 887 cases per million, and death of 7.3 per million, compared to South Africa, was at 25,800 cases per million and 869 deaths per million. So the southern region has borne the biggest burden in Africa. Okay, so that's a quick summary. I'll now move on to colleagues from Zambia. Professor Judith Hall and colleagues.
Thank you. Thank you, Mac. Thank you, everybody, for the kind introduction. I'm here representing Mothers of Africa with a tale to tell. However, I also run a big project called the Phoenix Project, and we did the same things. We mobilized at pace, safely, when it was required in a global pandemic. Let me share my screen with you now. It's been a challenging year. How many people have said that? There's been a terrible and distressing loss of life. The economic effects of COVID-19 have been enormous, and that's been felt very, very strongly in the countries that Mothers of Africa and the Phoenix Project supports in Southern Africa. People all over the world have suffered, and of course, this gives us, as global friends, pause for thought. But maybe, in spite of personal tragedy, there have been opportunities for growth and development, for doing things differently. Mothers of Africa, and actually the Phoenix Project, decided that we change or we lose the initiative, and thus we changed. In March 2020, a whole year ago, Mothers of Africa was in a very good position to deliver what was required of us in a global pandemic. The groundwork was done. Mothers of Africa is a listening, thinking together, and implementing project. We've been working in that way in Chongwe district in Zambia for 8 years, and elsewhere in Africa before that. We have even built, well, this was the first school that we built in Chongwe, Zambia. We know these kids, we're embedded in the community. We're very, very lucky to be part of this community. It gives us network, depth, trust, and thus, faced with a global pandemic, in a medical as well as community charity, we sort of know what to do. We move quickly. Mothers of Africa was started by doctors. We reached out now into very many multidisciplinary interventions in response to the United Nations Sustainable Development Goals. Mothers of Africa moved quickly. We immediately felt that we must be relevant. The first thing we did was we changed our website. The message is out there. We will respond to the needs of our partners, the people that we work with. Our earliest initiative was with Chongwe District Hospital, a hospital that we've worked with for over 8 years now. And our communication strategy was absolutely crucial.
Judith, sorry, could I, we can only see half the slide. I think we need to put it on the other view. Yeah, thank you.
I don't know how to change that. Shall I stop the share?
Yeah, if you stop and try and reshare again, that might.
Okay. Okay, let's just do that. Can you see it in that mode?
Yeah, fine, yeah.
Shall we stick with that for now then? Sorry that you can see the things at the sides. Is that okay?
Yes, that's great, yeah.
That's great. So, our secret weapon is a Zambian trustee for the UK charity, and our strength in depth, working with Chongwe District Hospital, we immediately asked the question, what is your need? Let's listen, let's talk. And we launched a PPE, soap, and project for the hospital to protect hospital staff. This was before Mothers Wales in Africa came out with any funding stream. We took the initiative, and thankfully, I'm just going to try and do this share now. Let's do another share. Thankfully, Wales in Africa were thinking exactly the same thing. So let us now turn to our partner and listen to Dr. Job Mwanza's voice.
Mwanza. I'm a medical doctor by profession, and I'm a public health specialist, a shepherding scholar graduate from Cardiff University in the United Kingdom. I also did a Famau professional fellowship at the same university through Cardiff. And I have known Judith since 2012 when she came to Zambia, and at that time I was in charge at Chongwe District Hospital. And through that meeting in 2012, we have collaborated through Mothers of Africa for the past 8 years now, and the collaboration has been moving from one level to the other. We've seen a lot of support that has come through to Chongwe District Hospital through Mothers of Africa support. Initially, in fact, the very first cesarean section that was done at Chongwe District Hospital was done through the support of Mothers of Africa. We had the visiting obstetrician and anesthetist from the UK, and they were around at that time. So we are really grateful to their support, that the hospital, through their support, and of course, the greatest support is from the government, but we had that partnership from Mothers of Africa that helped to operationalize the surgeries at Chongwe District Hospital. So for that, we are so grateful. With the COVID-19 pandemic that we are experiencing in Zambia and also everywhere in the world, Chongwe Hospital has still benefited through Mothers of Africa. There was a provision of face masks to protect the healthcare workers. As you know, hospital is a very risky environment concerning this COVID-19. And so Mothers of Africa was on hand to provide the face masks, but also soaps that were being used to ensure that hand hygiene was maintained at the hospital. Later on, we got support through the Welsh government, that is through the Wales and Africa funding, where there was additional support to protect the health workers as well as the community from the COVID-19. So through that funding, we were able to put enough signage at the hospital, but also did provide some more soaps, as well as introduction of elective surgeries at the hospital. That donation actually from the Welsh government was very instrumental in that we did engage the traditional leadership in Chongwe, and it's through her leadership that she actually made the donation on behalf of Mothers of Africa to the hospital. And that was key in that there is that strong support from the community leadership, such that now the community were able to understand the importance of putting on a face mask as you go into the hospital, because it's a risk environment. And so that was key to ensure that traditional leadership took that leadership to do that donation. So we are so grateful indeed for the support also from the traditional leadership that we are receiving through Mothers of Africa. When schools were opening, Mothers of Africa were instrumental in responding to the call from government that partners should come on board to help pupils as they go back to school. So Mothers of Africa did provide face masks and the soaps that were instrumental in ensuring that the pupils as they go back to school were safe. And this has been done. And as we speak, pupils have been going to school. There's been no problems. And also the hospital is operating almost normal now because the staff were built in terms of capacity of how they can protect themselves from COVID-19, but also hand hygiene and many other preventive measures. All these were provided, of course, government has been providing, but also with the support from the partners, specifically the Welsh government. So in conclusion, really, we would like to give special thanks to the Welsh government and through the Wales and Africa support, but also to Mothers of Africa for this great collaboration, and looking forward really continued collaboration as we together fight this pandemic, specifically to protect the people of Chongwe, with giving them enough information on the COVID-19, but as well as we look forward to the vaccine. With that, I thank you.
Thank you. It's been a fantastic project at the hospital for 250,000 people. Has been enabled to open safely. Let me look at some, do another screen share. I'll just leave it on this mode. So that was a fantastic collaboration with Welsh Government, with Wales and Africa funding, and the real big message is we worked sustainably within Welsh Government, within Zambian government structures for sustainability, and with traditional leadership for sustainability. It made a huge difference. But then there was another funding stream, another adaptation fund, and we then looked at our community and said, how can we help? And Job's already touched on that in the video. The children needed to get safely back to school. We have a very good relationship with the DEBS, District Education Board Secretary, Mrs. Ruth Pirias was, and now Joseph Chanda, who is the current secretary. It was in transition at that point. We applied for a grant for an enormous number of face masks to get the children back to school safely. And I think about 6,000 bars of soap. Yes. So I'm going to let the heroine of the piece, Mrs. Noriah Buleya, speak at this point. She is sort of like an ambassador for us in Zambia, a woman, a truly heroic woman, incredibly.
My name's Noriah Buleya. I'm the coordinator for Chikondi Sewing Club Women. Let me acknowledge the great work Mothers of Africa has done. Mothers of Africa has empowered our women in our group by buying us sewing machines. And then we could say that Mothers of Africa has been with us here to fight COVID-19 in our district, Chongwe. We've made 800 face masks for our district hospital, for our health workers, and also the frontliners to protect them. And the Mothers of Africa has gone further to make more face masks to protect our children in our schools. This is Shiara School, Evergreen, and Pango Hope Secondary School. And the total numbers that Mothers of Africa has made to protect and to keep children and also our health workers is altogether 7,800 face masks. And also Mothers of Africa has embarked in a project called To Keep a Girl Child in School by making sanitary towels, which are washable pads. And last year, Mothers of Africa made almost 300 washable pads that were given to Evergreen to keep a girl child in school. As I'm talking right now, Mothers of Africa has embarked in a project called Ending Poverty for a Girl Child in Chongwe district, that we are going to do it now for the whole district, which is a huge project and also huge numbers. We are ready to start making these washable pads to keep our girl children in Chongwe. For our further plans, as I'm talking right now, we've opened one sewing club, and these are the women, moms, their children with different disabilities. Mothers of Africa has come in to give them a skill. And as I'm talking right now, I want to thank the government, because the Member of Parliament for Chongwe, to appreciate the great work Mothers of Africa is doing to impact and also to train women, has given us space to do this work. To all I could say, I want to thank you so much, Mothers of Africa, for the impact. And as you continue to work and to impact and change lives in Chongwe. Thank you.
This is the voice of, all I said was, can you see the slides again? All I said to both of these people was tell your story. It's their story. And the really, really important thing about this story is that it starts with some women in a sewing club who make some masks for their own hospital in their own community. And then they get supported by Wales government with sewing machines. And the club expands dramatically, the skill base expands dramatically. And then they overdo what's required of the Wales and Africa grant and produce thousands upon thousands of face masks for the schools. So I think the message here is prepare for the fact that people will embrace and amplify the opportunity for their community. It's their community, it matters. So end period poverty, which he talks about, isn't actually funded, except it's those sewing machines that are going to produce 18, a pack of 5 each renewable, reusable sanitary towels for 18,000 girls at school of menstrual age in Chongwe. The whole of them, of that population will be provided. So this is incredible amplification. These girls otherwise lose 25%, 1 week a month of their school because they do not go to school. This is amplified into a club for mums of disabled children throughout the whole of Chongwe. A new base, a second club, and indeed, she started, this is a wonderful woman, doing life skills, including sewing, for the Mothers of Africa schools. And she's just asked us for more sewing machines for life skills teaching in the schools. Mothers of Africa says yes. To summarize, these are the women in this slide. This is the first build that Mothers of Africa did. This is the Adult Education Centre. This is their cooperative home. This is our solar panel, solar powered centre that they use for their own small businesses, and they create wealth from it. These women are also builders. They also get involved in building our schools, and they get paid for that. It creates wealth in the community. I know these women very well. We're a partnership. We listen, we think together, we implement, we're constant and reliable. We moved quickly last year, and we communicate with everybody. Everybody we possibly can. Sometimes we get it wrong, but we do. We work within government structures for sustainability. Those schools are not Mothers of Africa schools. They are handed over to be Zambian schools to work with the Zambian system. The Zambian system provides teachers. We work with traditional leadership because we would never be without the traditional leadership. The woman in the photograph handing over the soap is actually the chief of the House of Chiefs. She happens to be the chieftainess in Chongwe, which is probably one of the most important people in the country. We value her. And always be prepared for the fact that your partner will take control, and when they do, and when they know what's best, that you would support them. We know we have the right collaborator. We've been working together for very many years now, and we trust each other. There's so many people to thank. Hub Cymru Africa, Wales and Africa, Noriah herself, Job, the government, the Debs, the area MP, the trustees, and I'm happy to acknowledge that we have a sister charity in Monaco, and they're online today. Mothers of Africa Monaco are a great fundraiser and project lead for us, especially in building at the moment. But the people who really need thanking are the people of that sewing club. Days on end are spent volunteering, making masks, making sanitary towels for the good of their own community. For the sake of, we give them sacks of nshima and some general thank you stuff, but really they do it themselves, for the people that they care about. I'm lucky to be part of this collaboration, and so is everybody else really that supports Mothers of Africa in Zambia. Thank you very much.
Thank you, Judith. Can we move on to our colleagues from Lesotho now, please? Lesotho?
Hi, yes, I'm here. Hi, can you see my screen okay?
Yes.
Great. Fantastic. Hi, I'm very pleased to be here. My name's Kate Shakespeare. I'm a clinical psychologist. I work in North Wales Health Board, Betsy Cadwallader University Health Board. I'm speaking today on behalf of Dolen Cymru and the project that they enabled, and a strand of that project, which was the SUS Lesotho project. So just briefly, I'm going to give a bit of an outline for what the project entailed, how it was funded and collaborated, how we collaborated with our folk in Lesotho and what we actually did. And then we've got Mosa who's going to talk about her experience of being part of the project. I've left Dr. Moseme's name there. He sent me his apologies today to say that he wasn't in a position to make a video for us. The context in Lesotho, as you can imagine, remains very difficult, but I felt like it was important that he was acknowledged as somebody that had volunteered to provide his input. Okay, so as a little bit of context, the Staff Wellbeing Support Service in BCUHB in North Wales was set up as a COVID response service in March 2020 and was made up of volunteer clinical psychologists and psychological therapists who redeployed themselves from their pre-existing services. So I worked in that service from March or April till September, providing psychological support for staff in North Wales. And then we were approached to see if we would like to or would be interested in providing support for medical staff in Lesotho. So we were approached by Dolen Cymru for the Wales Africa Grant Scheme, and of course we said yes, and we got some match funding from Our Las, which is our charitable group within our health board. And the project funded, it was run for 6 months, funded 2 clinical psychologists, myself for 1 day a week, and my colleague Laura Perry for half a day a week. It had a number of other strands, including funding PPE to be purchased and sent out straight away to Lesotho as they were having a significant shortage in September. And there was an education strand as well as part of the Family Medicine Speciality Training Programme, which is where the registrars have their training. And it was that programme that identified that their registrars were extremely distressed and might benefit from psychological support. A survey was offered to the registrars who agreed that yes, they felt that it would be helpful to have some additional psychological support. And we were very fortunate to have a link person in Lesotho as part of the family medicine training programme, Courtney, who was already considered the registrars, they knew her well. And honestly, she was vital in the success of this programme from us over in Wales, working with the registrars in Lesotho. Okay, so there were a number of elements to this project. So the first and main element was offering the registrars individual psychological support sessions with me via WhatsApp video calls. And these ran for an hour long, and registrars could capitalise on these as much as they needed to within the realms of the project. So they covered as many sessions as they felt they wanted. Another important strand was group-based compassionate leadership sessions. Now, some registrars had already expressed an interest in learning about how to adequately support their staff teams. Some of the registrars were in positions of significant leadership in their hospitals and their districts, and were very aware that their colleagues, their nurses and allied healthcare professionals were also extremely distressed and frightened, working in very difficult circumstances. So these leadership sessions were developed using a number of models which asked the registrars to think about the impact on themselves that the pandemic has had and the impact on their staff teams that the pandemic has had, and then consider, based on the evidence base, what initiatives, strategies and approaches might be applicable to their workplace that they might be able to enact. And also to think about what the barriers to that might be. And that could just be enough staff or safe provision of staff, or what the hierarchical structures are which enabled or inhibited making changes in their systems. A final session, which unfortunately we weren't able to deliver live, was on lasting stress and distress and the predictors, precursors and risk factors for long-term post-traumatic stress responses. In January, as some may know, the second wave of COVID had started over the Christmas period in Lesotho and had overwhelmed the registrars. Their training programme was suspended, and we set to adapting this project to enable the registrars to feel supported while also letting them get on with what they needed to do when they were there. So all our sessions were recorded for them so that they could access them remotely afterwards in their training programs once that restarted. So other less direct elements of the project were to develop video and written resources that the registrars could use beyond the 6 months that this project was run. So some of those were lots of my face, as Mosa I'm sure will attest to, doing brief breathing and grounding exercises, 5-minute me spaces to foster compassion, which we know is an extremely important element to supporting anybody developing resilience in their workplace during such a frightening time. And honestly, we'd learnt a lot about that from Wales. So a lot of what we were using was what our colleagues in Wales had experienced, and hearing the parallels in Lesotho, albeit their contexts were very different. And then a series of written resources that they could either use for themselves or disseminate amongst their staff teams. So at all times, the videos and resources are available to any healthcare professional that the registrars feel they want to share them with. These resources have also been placed on a Padlet platform, which is hosted by Dolen Cymru, which is now disseminated to any healthcare professional in Lesotho, not just the registrars. And that includes the videos of my face, all the written resources and recordings of the compassionate leadership sessions, so that the hope is that it has a more systemic impact across Lesotho. We also shared policy documents that were helpful for thinking about the systemic impacts of a pandemic in the healthcare setting. So they would be sort of more British-centric ones like the King's Fund, but also documents from IASC and from the World Health Organization. The idea being here that as a psychologist, we know that as soon as we have extreme amounts of stress, we all become overloaded. And so the idea was to make it as easy as possible for the registrars to get their hands on relevant and important information should they need it without having to look for it. So that it takes a task or a barrier away from being to using relevant legislation if they want to make a case for changing the way their workplaces are structured to enable people to feel safe and to feel cared for, and of course to help with retention of staff. And just a final bit is feedback and dissemination. So we wanted to make sure that people were aware of what the registrars were experiencing. This is a good example of that. We fed back to the Dolen Cymru steering group, and we're writing something up in the hope that we can demonstrate what we can do in a short period of time, working collaboratively with the registrars and honestly being guided by them. What did they want? And working in a very, don't really like the word, organic way, and responding to the needs as they arose. And then just finally, I've popped a little thing here about a 20-minute care space, which we ran in one of the group sessions and formed the basis of a lot of our work, which was about fostering compassion and cohesion amongst the registrars, because the evidence tells us that when teams are well cohesed and they're able to support each other, they're much more resilient over long-term distress and stress. Okay. So I think we're going to hear from Mosa now, but in place of Moseme, I've just done some quotations from feedback sessions from a range of the registrars that I thought I would read out so that you can get a flavour from some of the other participants. So I'm just going to drop my thing. Okay. So I really appreciate the support and has really benefited from it, and even recommended to my close relatives. It really worked for me as I was also affected by depression. Thanks again for your support. And that was a session on looking at the personal impact of working in a pandemic or being in a pandemic. To me, I think it is a self-care which can help myself to reconnect with my body, my mind, and my soul. I think it's important or would be useful for people in management positions to get the same experience of compassionate leadership. I think the team did well on presenting the talk. That was from the 20-minute care space session. And another one from the care space. The care space experience was great. It was good to share in a confidential space with the partner I had. Time allocated seemed to even fly by too fast. Indeed, expressing oneself without judgment and a sense of some support and advice is the best feeling during stress and distressing times. And then finally, I think there is room for allocating more time to the care space, especially for the people who experience it for the first time. I also think it would be great to give more advice and suggestions on how people can pump up their soothing mechanisms. And that's a direct reference to one of the psychological models we use to help registrars think about threat and drive and their soothing systems and the importance of fostering soothing. Okay. So I will stop sharing, and that is everything from me.
Okay, great. Thank you, Dr. Kate. And now Dr. Mosa, if you're able to share things from your viewpoint, that would be great. Oh, you appear to have frozen. Hopefully your connection will reconnect and we'll get you back. Okay, looks like we're having some technical difficulties. Hopefully Dr. Mosa will rejoin us at some point, but I don't know if anybody has any questions. Sorry, Mac, I'm totally taking over.
It's all right, you got connections there.
Yeah, I don't know if we want to see if there are any questions from what we've heard so far.
Yeah, we can take questions while Dr. Mosa is organizing herself to get back online.
Great. Okay, so if anybody has a question, if you want to type it either in the chat box or in the Q&A box, or you, yeah, and we can answer them that way.
Hello?
Ah, Dr. Mosa, is that you?
Yes.
Ah, fabulous. You're there.
I'm sorry. I'm freezing and I don't know what else happened. I'm sorry for that.
No worries. Go ahead.
Okay. Well, Dr. Kate has said quite a lot more. I'm Dr. Mosa Talhale. I work in one of the district hospitals in Lesotho and a family medicine trainee in Lesotho through the Leboha. So it's when I was in that family medicine training program that we heard about the staff support, the psychological support. So we are always under stress and we are always working quite more than we can bear, even before the COVID pandemic. So when that pandemic came to us, it was just like a final tip off for us to fall. There was just too much going on in our lives, in our day-to-day jobs. And now there was something additional that is very, very serious and demanded attention of everybody. It didn't matter if you were the one on duty or not or whatever. So it was really stressful. And particularly for me at that time, I had just found out I was pregnant. So it was even more stressful for me. And I think it was just a lot of things that were happening. And when we found out about the possibility of mental health support, I really felt I needed it. It's something that's not really been attended to in Lesotho until so far. So we've really been grateful to the project that has been made, because it's providing us with that much support that we needed. We always felt like we are working and we are just considered to be like robots. You know, you have no feelings, you have no time when you feel overstressed. You just need to keep going and just make things happen. Patients are looking up to you. Everybody's looking up to you, especially in my district, because there's no other district hospital. There's no other hospital at all in my district. So yeah, I was extremely burdened. I just needed support. And for most people, you feel like you have to be strong, even though you're not feeling good. You still need to show up. You still need to deliver. And when you're maybe discussing with some people, they might just feel like, oh, she's just moaning. Like they don't really appreciate you trying to offload or vent or try to get a shoulder to cry on. So I found it a great opportunity because I could find somebody who I can talk to if I want to cry or whatever, and I won't get judged in any way. Rather, I'll just maybe get some ideas of help, those little things that I might do that may make me feel much better. So yeah, that has been the experience that I've had. I found the project to be very good for us. Sometimes, you know, when people are talking and they're not in the situation, you might think, if only you knew what you're saying. I know sometimes Dr. Kate would say like, okay, it feels like you're in the bathtub and the water just keeps going up and up and up, and finally you feel like you're drowning. And that's exactly how I was feeling. So those little things that we were doing, the discussions that we're having, and maybe just having an opportunity to speak, almost getting to tears. Then afterwards, I just pick up and continue with whatever advices that I might have gotten, had helped me a lot to be able to bear the situation and to try and reduce the impact of the stress that was coming upon me, given that I was also pregnant at the moment. So it was really important for me to de-stress. And even with the colleagues, we might want to support each other, but if we are all feeling like we're drowning, there's no one who feels like they can save somebody. So it was a good opportunity to be in the program, even if I cannot do so much for my team, but I can be able to offer a little bit of support. Yeah, that's
that's what I liked about it. And the nice thing is you had your one-on-one, you know, I can just talk, and Dr. K can listen and maybe talk at some point. Like there's not many people all the time, so much that I may feel I cannot express myself in other ways, although there were group sessions which were good as well. And like I like the care space a lot in the group session, because even though we're a group, it's just time that you just have to zip up and listen to the other person express themselves so much. So it's nice because you just go on until you feel like, okay, that's better. So yeah, I really appreciate it. I still appreciate the program so much. I think there's a lot that they did well. We enjoyed all the sessions that we had, the group sessions and the recordings, the videos, that even though we're not having a live contact, there's still some support that is coming through, that there's still some advices to say, well, maybe if you need this, you could do that to feel a little better. It's something very good. And I know it's not because things are too easy for everyone else around the world, but sometimes I just feel like they're just too much for us, more than other people. So I still appreciate a lot of help that's coming from everybody, even though they're also facing the difficult times. Yeah. So far, there's not much that I can say I would change in the project. Even it's just continuing as it is, because it's been doing well, really. And I'm happy to say I did make it through. I had my baby girl. She's doing quite well now. We are all okay. Yeah. So that's very good. Thank you.
Thank you, Dr. Shabali. Yeah. Right, can we move on to questions? Beth, presumably you've got access to the rest of the audience who want to ask some questions.
I do, yes. We've had a couple of questions come in. So the first one is, I've really enjoyed the conference this year, as the digital nature of it has enabled partners in Africa to have a platform which otherwise would have been difficult. Is this something to be harnessed as a result of COVID-19? And what are the panel's plans to further equalise the relationships between them and their partners? Who on the panel would like to take that?
I can make, I mean, for us, the virtual platforms were absolutely invaluable. Just the ability to send a WhatsApp message to Mosa with a video on, or to send it, or to have an online platform that anybody can access. We should have said part of this project funded data so that the registrars were able to, they were paid for to have access to these online sessions. So they were absolutely invaluable, and the power of technology has meant that I could sit over here in Wales and the registrars could tell me what was pertinent to them and what they needed, and then we could do our best to figure it out from this end. I think there's probably more scope for understanding access to technology from my perspective, I suppose. So we generated all these fancy infographics, and then Courtney in Lesotho kindly reminded us that there were no colour printers in Lesotho. And so, and we just didn't have any appreciation of that really. So that was really invaluable, just to understand what it is that people really do have access to, and to understand the context that they're living and working. Although we were all in a pandemic, that sort of metaphor that we might all be in the same sea, but we're not in the same boats, is hugely important, I think, from our side to recognise. And when we've had discussions about if Dolen Cymru applies for further funding, is really to get a good sense from a co-produced perspective of what is it that people want, and how are we able to do that? So how Dolen Cymru might move forward in the future be purely guided by the folk that, by the collaborators in the country itself.
Can I just ask? So I was just going to ask
communication with the rest of the links in the south is something that West Africa Health Links are working on, but I don't know how far the project has gone. It's something I can actually bring up with the IT people and see how far it's gone, and come back to you.
Could I just ask, on Kate's point, I was going to ask Mosa how she felt about that in relation to, the project. Obviously, what you talked about was amazing, and what you've experienced, and just really grateful to you for sharing it with us. And I wondered, in terms of the future project, do you feel that you would, you talked about being able to better support your team, but do you feel like that's something that you could take forward, you would want to take forward in the future in Lesotho with your team, or how do you feel about that?
I feel, yes, for as much an opportunity or a chance that I may get to forward it to the team is quite helpful, because as I said, in country, there is not much of mental health support. There's now not enough of psychological support for the healthcare workers. So yeah, for me, if it could keep continuing, it would be good. And if I could get more opportunity or more capability or all that I need to help my team, is quite good. Sometimes it doesn't need to be a lot, maybe that's been given or what, but just somebody saying, usually people are like, hello, how are you? And while you're trying to say, well, I'm not good, they're already gone. So it's good to just have somebody actually ask how you are and listen to how you say you are, and be able to say, well, maybe I may not be able to help you in all that, but I could try and help you in this little bit. I think just that makes one very much appreciated and can keep motivating you in other areas that maybe you felt like you were not doing well. There are some instances that while I'm discussing with Dr. Kate, I may have felt like maybe I'm not doing quite well, I'm struggling with that. And it would be good to hear from her saying, well, that's actually a good strategy. Maybe you can keep that up. Maybe you can keep continuing that. It will help you, and eventually. So I think it's a good project to keep running.
Yeah. Great, thank you.
Yes.
Should we go back to? We're running a bit short of time, but there's a few other question. So this is, I think, for you, Mac. Are there states which, either like Tanzania, were not looking for COVID or unable to monitor the real situation? So where in Africa do we need to be prepared for serious numbers of people becoming infected? And other than in South Africa, which countries have the capability of producing vaccines? Should either patent rules be relaxed or Big Pharma set up production facilities with Western funding? That sounds like a massive question that we could probably debate for the next 3 hours, but can anyone have a very succinct answer to that?
There is in the country in Africa that produces vaccine. All the COVID-19 vaccine is currently made in Western Europe or America or India. The AstraZeneca vaccine is licensed to also be produced in India. You might have seen something on the news about it yesterday. So in terms of Africa having a capacity for vaccines and medicines for COVID-19, etc., they're very much dependent on what the rest of the world is actually able to do to help them.
Yeah.
Right. We're running out of time, so I think I'll have to sum up now. I'd like to thank our colleagues from the Mothers for Africa for their contribution, and also colleagues from Lesotho. One of the things we haven't touched on is the so-called paradox of the numbers expected in Africa has been lower than, but the actual numbers have been lower than what we have actually seen. One of our colleagues from Zambia was actually going to talk about that, but hasn't been able to make it. There was a paper in the BMJ that they produced. It was in the BMJ last Friday. And they did some research in the University Hospital in Zambia, whereby they looked at the deaths over a 3 months period. And they found that 16% of all deaths in the hospital were due to COVID-19. Whereas before that, I think the impression was that there were very few people dying of COVID-19. Of those 16%, 76% were in people aged 60 years or less, and 10% in children. So really, the impression that COVID-19 has been not as huge in Africa as in the rest of the world really is really because of the limited facilities available for diagnosing COVID-19 in most of Africa. Not that it hasn't been a big problem. I think we'll hear more from about it as the reviews continue in the future and more research is done about it. Sadly, Africa is very much dependent on the rest of the world helping it in terms of the control of the pandemic. We've seen a lot about vaccines and vaccine politics, politics in Europe, and politics about supply of the vaccines to the rest of the world, including Africa. Hopefully the situation will improve in the future. And on that note, I'll bring it to a close.
Great, thank you so much, Mac. Sorry, Isabel, I can see you've got your hand up, but I'm afraid we've run out of time. We've already run slightly over, but I'm sure it's a subject that we're going to come back to over the coming months, because obviously this is something we'll keep on learning from. Kate, did you want to say something? No, okay, sorry. Yeah, I just wanted to say a big thank you to Mac, Dr. Mosa and Dr. Shakespeare, and to Judith for their contributions today, and to all of you for joining us. We've got another poll. We'd really appreciate if you could complete the poll so that we get some feedback on the sessions, and it enables us to improve them for the future. So there's an on-screen poll, and there's also in the chat a link to a longer form where you can put some more feedback, written feedback for us, rather than just ticking a box. Yeah, so thank you again for joining us. We're nearly at the end of the summit. There's a couple more sessions this afternoon, which you can still sign up for if you haven't already. And this session and the others will be available on our website in the coming weeks, so you can always watch again and review. So just going to give that a few more seconds. Yeah, it was really good. I really enjoyed hearing directly from the projects. I thought that was really interesting, and I thank you, Mosa, particularly when you've got a newborn baby, for joining us. That's quite amazing logistics that you've managed to dial in, and just really hear. Yeah, I really enjoyed hearing your experience, and yeah, fantastic and amazing that you've been what you've been through as well. Thank you. Right, I'm going to end that now, and I'm going to end the session. So thank you to everybody. And
thank you very much.
Again, thank you. Bye.
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 Thank you, everyone. Goodbye. Goodbye.
Bye.